Rahul, Gade, Ravi, Tuskin, Jaswinder, Monica, and many more across the country. Welcome to Chai Pe Charcha for NEET PG 2019 with Dr. Murali Bharadwaj. So, AIIMS November 2018 is a very compelling entrance exam, and yesterday we discussed around 20 questions. Every day we will discuss 50-60 questions. Most important thing is to discover the pattern. What are the topics which are hot topics for the examiner as usual? That is the most important part of the story. Can you please punch whether the voice is loud and clear? The empty blood bank is disposed in which color bag is a very important question. Baba, black sheep, have you any bags? What is the color of them? Favorite topic, without a biomedical waste discharge, there will be no question paper. It is the yellow bag is what you need to basically appreciate. So how do you remember? Is there any easy way to remember? The biomedical waste is a very important question. HAM, Human Animal Microbiology. These are 1, 2 and 3. Then sharp medico bloody solid. Sharps, medicines, blood stained or soiled and solid. 4, 5, 6, 7. Then 8, 9, 10 is Lakh. That is a liquid, ash and chemicals. Some stupid way we have to remember these stupid things until the stupid exam is over. After that we can as well forget them. Then what is the color coding is a very important question, and how do you dispose the bag is another thing. Once more JIPMAT, once more NEET PG में same biomedical waste discharge के बिना paper ही नहीं रहता. Paper NEET PG is not for 300, it is for 299. One question invariably from biomedical waste discharge. Yellow, 1, 2, 3, 6 will go into yellow. So the human animal microbiology are the ones where empty blood bank also goes into the yellow is what you need to basically remember. Then you incinerate or do a deep burial for this yellow story. Then the red 3, 6, 7 will go into red. Autoclaving, microwaving and chemical treatment. Then blue and white translucent, you have 4 and 7. And you do autoclaving, microwaving, chemical treatment and destruction and shredding. Then the black has got 5, 9, 10. And you have to put it in a secured landfill is what you have to ultimately remember. So let us quickly run through the various categories. Aur ek baar. Welcome to 107 online viewers to this AIIMS November 2018. This winter doesn't come back in the life, but the memories are left with us that we were the students preparing for the NEET PG every day evening on this cold winter. So doctor, category 1, human anatomical waste. You have human tissues, organs and body parts. Category number 2, animal waste. The animal tissues, organs, body parts, carcasses, bleeding parts, fluids of the animals, etc. Category 3, the microbiology and biotechnology waste. Category 4 are waste shops that include the needles, syringes, scalpels, blades, glass, everything. Category 5, the discarded medicines and cytotoxic drugs. Typically the waste comprising of outdated, contaminated and discarded medicines जो होता है 5 के अंदर जाता है. Category number 6 is the solid waste, soiled waste. Soiling occur for the cotton dressings, soiled plaster casts, etc., etc. Then category number 7 is the solid waste, which typically include the tubings, catheters, intravenous sets, etc. Category number 8 is the liquid waste, the favorite question of the examiner, where you do housekeeping and disinfecting activities in the hospital. So all that liquid waste. Category 9 is that incineration ash. And category number 10 is the chemical waste, is what you have to ultimately remember. Now, leptin, ghrelin. Without this, there is no AIIMS question paper. Once more, very standard question. Obesity. Some of you are going to be top bariatric surgeons in the times ahead. So that's the reason everything about obesity. पीजी में सीट आने तक खाने के लिए पैसे नहीं रहते, सीट आके एमडी खत्म करके कंसल्टेंट बनने के बाद खाने में टेंशन होता, because all your sedentary life make you too fat. Let's talk about obesity. Leptin has a permissive role as a hormone. It signals the energy deprivation state. If you don't have sufficient energy, that energy deprived state like protein energy malnutrition that stimulates the leptin is what you need to remember. Leptin also has got the ability to release the gonadotropin releasing hormone. That is the reason leptin has a role in the pubertal development, is the second important role. So leptin, it is produced in the fat cells and it is a product of the OB gene, and the leptin receptor is the product of the DB gene, which is also called diabetes gene. And what are the functions of leptin, doctor? Leptin stimulates the physical activity. It leads to heat production and it will lead to the expenditure of the energy, is what you have to basically remember. Now, you know, a historical figure in Mahabharat. NEET PG is like a Mahabharat only, easy to remember with a lot of Mahabharat stories also. More than Mahabharat, Ramayana. Lakshmana's wife, the Rama's brother Lakshmana, that is Rama's sister-in-law, Urmila. Urmila, while waiting for Lakshmana's arrival, for years together could be able to go into a hibernation without hunger and without eating. Probably what is the reason, you know? It is the leptin. So what is leptin? Leptin inhibits the hunger, is what you have to remember. The buzzword is leptin inhibits the hunger. So what is the cause for obesity? Leptin is produced by the fat tissue. It is supposed to go to the thalamic areas which are important for getting that satiety, the sensation of satiety. Whenever you eat, no, wow, what a nice food, that satiety of fullness will be there, no? That normally comes. So, typically, that sense of satiety which inhibits your hunger is all because of the effect of the leptin on the brain. So, in obesity, there is a decreased sensitivity to the leptin, and that is the reason they don't have a sensitivity of satiety and they keep on eating continuously without the inhibition of the hunger, and that lead to development of the obesity, is what you need to basically remember. So Ravi is saying, after seeing some questions in AIIMS, some of the confidence is being evaporating. Is confidence a liquid or a solid? Ravi should have solid confidence. Of course, there are a lot of areas we will be having filling defects, like the dental filling defects. We have to fill all those areas. Once your 650 topics may, at least 500 topics, once you have reviewed the previous DNB question bank and all, these are all the same things repeatedly asked over generations Almost 20 years we have been seeing the question papers discussing the way we are doing today. Same topics, same issues will be there. There is nothing. But पहले बार examination hall में leptin का परिचय हुए तो obviously we lose our confidence. So don't worry. Give 200 to 300 hours of your time to me. I will create a solid confidence that will never evaporate. That's my promise to you. And we all pass it through the same stage, let me tell you. Right? Now comes, which heart sound is considered to be normal finding during pregnancy? This is a very good question. Already you know, give me the board. First heart sound, second heart sound, third and fourth क्या होता है बताएं, बात करेंगे अभी. What is the meaning of S3? What is the meaning of S4? Let us discuss. Why S1 occur? S1 occur because of the closure of the atrioventricular valves. S2 because of the closure of the aortic valve. And S3 obviously should come after the S2, right? So that means after the closure of the aortic valve, the S3 should come. Now tell me, what do you mean by systole? The left ventricle, when will it undergo systole? After the first heart sound. That is, atrioventricular valve close होने के बाद, that is the end of the filling of the ventricle, and then the ventricle will start contraction, and that is basically called systole. So between S1 and S2 you have the systole. Then after the closure of the aortic valve, which is S2, what will heart will start doing? The mitral valve open and the blood start moving into the ventricle. So that is the reason between S2 to S1 what you have is called as diastole. Now that is ventricular diastole. So where should S3, S4 should stay? They should stay after S2. That is the reason S3 and S4 occur during the diastole. So when will S3 occur? In the first 1/3 of the diastole, you get the S3. During the last 1/3 of the diastole, what do you get? S4. And what is the cause for the S3, which is happening in the first 1/3 of the diastole? Right? Now, what happens in the first 1/3 of the diastole? How is the diastole of the ventricle? Tell me. Typically, if you look at the diastole of the ventricle, you have first 1/3, second 1/3, third 1/3. That's how you can be able to divide the diastole of the ventricle. During the first 1/3, the moment there is an opening of the atrioventricular valve, the blood is jumping into the ventricle. And that is the cause for the first 1/3. Last 1/3 of the diastole may, atria is undergoing contraction and pushing the blood into the ventricle. But first 1/3 is already the atrium is fully pregnant with the blood, and the moment AV valves open, the blood will jump into the ventricle, and that is first 1/3 of the diastole. And second 1/3 is because atria are at a higher level than ventricles, gravity pulls them down. Third 1/3 may atria contracts and pushes the blood into the ventricle. Now why this early diastolic heart sound S3, why does it happen? It happens in case of left ventricular failure. The third heart sound S3 is called the ventricular gallop. Typically happens whenever the left ventricular failure is there, That lead to development of the S3. Why should it lead to S3 is the question. Why LVF should lead to S3? If the LVF happen, if there is a LVF, when before the diastole, what was happening? Systole. So ventricle is supposed to eject all the blood into the aorta. But in case of left ventricular failure, it can't eject all the blood into the aorta, at least 65% is ejection fraction. So lot of blood remains in the ventricle at the end of the systole if there is a left ventricular failure. After that, when the diastole begins, what is happening? This blood in the atrium, which is jumping into the moment AV valve open, jumping into the ventricle. Where is it jumping into? Have you jumped into swimming pool? If you jump into swimming pool, a splash of sound will come. That splash of sound that occurs when the blood in the atrium jumps into the ventricle, which is still having some leftover blood because of the left ventricular failure and a failure to pump during the preceding systole, will lead to the development of the S3 is what you need to basically remember. That's the reason left ventricle S3 is a sign of left ventricular failure. Then what is the reason for S4? It is a late diastolic sound. Typically during the last 1/3 of diastole, what is atrium trying to do? It is trying to contract and push the blood into the ventricle. So, if a person has hypertension, because of that, he developed left ventricular hypertrophy. This hypertrophied ventricle is not ready to further distend and receive the blood. When the left atrium contracts and trying to push it into left ventricle during the last 1/3 of the diastole. Because of that, what will happen? The left atrium has to further roar and push the blood into the non-compliant hypertrophied left ventricle. And that creates the sound which is called S4. S4 is a marker of a non-compliant left ventricle which is hypertrophied, and it is caused because of the increased pressure with which atrium pushes. That's the reason S4 is called atrial gallop. And S3 is typically because the left ventricular failure, it is a early diastolic sound after the S2, right? And that is called ventricular gallop is what you need to remember. S3 is still considered to be a normal finding in certain situations. What are the situations? One is pregnancy. Other is in the children. Why is the question. In pregnancy, there is a lot of progesterone. Progesterone vasodilates the vessels. Because of the vasodilatation, what happens? When the blood is pushed into the vessels, the blood can run very fast and then come back into heart. So because the circulatory time of the blood is decreased, even though heart is normal, ventricle is normal, the homework that the ventricle has to do, no? Instead of 5 liter को बाहर करके फिर 5 liter receive करने के बजाय, it is that is within 1 minute. It is doing that within every half minute. Ventricle will get, oh my God, so much pregnant blood. All this blood is coming back, very short time because of the decreased peripheral vascular resistance. Oh my God, I'm tired, says the left ventricle. The moment the left ventricle says tired, what do you get? S3. That is what you need to appreciate. So this is the typical story that you have to tell to all your house surgeons. The more and more and more you start teaching, the more and more your own concepts become better. So doctor, any S4 is abnormal, but S3 can indicate it is a left ventricular failure, or it can also be a normal finding whenever there is a hyperdynamic circulation in the case of the children with tachycardia, natural tachycardia. Heart rate is very high in children, normally only. And in pregnant women is what you have to basically remember. That's good. Ashima said, wow, I'm just waiting for that, right? So one thing to remember, you have a diaphragm, you have a bell. Why do you use bell? Bell you will use for those heart zones which have a higher amplitude. Bell के अंदर बहुत गुहा रहती ना. So high amplitude, low pitched, low frequency sounds के लिए bell इस्तेमाल करते. Low amplitude, high pitched sounds के लिए diaphragm इस्तेमाल करते. S1, S2 you listen using diaphragm, but S3, S4 are low pitched, high amplitude sounds, and that is the reason typically you find the S3 and S4 के लिए you have to use the bell but not the diaphragm. Bell का भी जरूरत नहीं है. One case of LV failure who has got a myocarditis, classical example that you can see in the acute medical care unit is, go and ask your MD general medicine guy, hey Anna, please show me one toxic myocarditis, viral myocarditis. Hey, that bed number 6 he will say, just go to the side of the patient, tachycardia will be around 140, 150 on the ECG monitor. You don't need even stethoscope. It's a palpatory finding because it has got any sound that has got a higher amplitude can be perceived with even your palpation. Those which have low amplitude, high frequency require a diaphragm of the steth is what you have to fundamentally remember. Then a very big challenge when you have S3 is, S3 occur very close to the S2. S2 के बाद diastole शुरू होता. So S2 के बाद immediately S3 will come. So you don't know whether it is a S2 or S3. How will you differentiate? One, S2 is a high pitched or low pitched. It's a S2, second heart sound. Diaphragm से इस्तेमाल करके सुनते, इसलिए it is a low amplitude, high pitched. Whereas S3 is high amplitude, low pitched. इसलिए that is one differentiation between S2 S3. Then S3 is heard best in the apex of the heart. Whereas to listen S2 typically in pulmonic area, in the second left intercostal space, you put the stent for listening to S2. So that is a fundamental difference.